Hello class, my name is Professor Alfaro, and now as we enter into week 7 of the program, our focus shifts to the Chronos system of Bronfenbrenner's ecological systems theory. This level interacts with all other layers of an individual's environment. In healthcare access, this means that a person's ability to get medical care shifts from over their lifetime and is profoundly impacted by when events occur in history. Therefore, we will delve into the roles these events, life and historical events, and how they've influenced healthcare and certain demographics. Please find the learning objectives for this week's lesson. In order to reduce extraneous cognitive load, please take a moment to pause this recording and thoroughly review this week's learning objectives. The first article by Noreen et al. Speaks to Bronfenbrenner's ecological systems theory. This study found that educational inequalities during the COVID-19 pandemic were shaped by interconnected factors, including family income, paternal education, digital access, institutional support, and broader structural disparities between rural and urban communities. In the article by Serial et al., we are reintroduced to systems thinking. This article describes how a region-wide healthcare collaboration improved patient safety and clinical outcomes by using systems thinking, shared learning, data transparency, and frontline problem solving to create sustainable quality improvements across healthcare organizations. And in the next article by Trigo, we explore innovation in the era of experience. This literature review illustrates how patients have evolved from passive recipients of care to active contributors and innovators whose lived experiences, insights, and collaborative partnerships with providers drive meaningful healthcare innovation and service improvement. In the fourth article by Bianco Mathis and Burrell, we gain an understanding of culture change. This article explores how healthcare leaders can navigate post-pandemic organizational transformation by fostering adaptive cultures, coaching-oriented leadership, workforce resilience, and strategic change management practices that support long-term organizational effectiveness. And in the next article by Todd, we are introduced to a comparative analysis that found that healthcare systems use varying combinations of regulations, financing, direct service provisions, and information sharing strategies to achieve policy goals, reflecting each nation's unique governance structure and healthcare priorities. In the last article by Lequidget et al., we found the power of connectedness. This study found that connected healthcare technologies, including digital monitoring devices and personalized feedback systems, can improve medication adherence and reduce hospital readmissions when interventions are timely, targeted, and supported by active patient engagement strategies. Now that you've come prepared to class by completing the readings and assignments and watched this lecturette, please find the agenda and timeline for the remainder of the lesson today. After this recording, you will be asked to go into your assigned breakout rooms. Within your group, reflect on the readings of this week amongst your breakout group members and assign a representative to share out shared key takeaways with the rest of the class. Once we have gone through all of the group shareouts, please be prepared to return to your breakout groups and now make the connections with this week's readings and provide a real-world experience or constructed real-world example. And please be prepared to have your group representative share out with the class once more. This will be our way of evaluating and assessing your understanding and application. We will end this class answering questions and providing you with a look of what's to come next week by reviewing the syllabus together. Now, please wait to be taken to your breakout room number 1.